The University of Colorado School of Medicine, in partnership with UC Health, has created the Adult Neurodevelopmental Disabilities Clinic. The clinic offers coordinated healthcare for adults with developmental disabilities and support for their families. Visiting with us today is Dr. Jessica Solomon Sanders, a behavioral neurologist specializing in neurodevelopmental disabilities, to talk about the clinic. Dr. Sanders, thanks so much for being with us today.
Thank you so much for having me.
So your specialty is in neurodevelopmental disabilities. Do you want to give us a little background on that and explain what that is?
It's a fairly new specialty within the last couple of decades, and it is not very well known. So I'm very excited to share about it. This specialty allows me to be a neurologist and a developmental specialist for children and adults with neurodevelopmental disabilities. The training for becoming a specialist in neurodevelopmental disabilities, called NDD, is 6 years long. So after medical school, you do 2 years of pediatrics residency, followed by 4 years of neurodevelopmental disabilities. And that 4 years of NDD training includes adult and child neurology and training in developmental pediatrics. And the whole 6-year residency together lends you to being specialized in neurodevelopmental disabilities.
So I know you're also involved with Children's Hospital Colorado. You work with children. So you kind of handle both ends of the spectrum. And from what I understand, there is somewhat of a gap in the care once a child becomes an adult. And that's starting to change now. And I know a practice like yours is contributing to that. You want to explain that a little bit?
Absolutely. I mean, I think that's an understatement. There's a huge gap in access to and quality of care, specifically for the neurodevelopmental disorders as children age into youth and adulthood. And I feel very lucky to be here in Colorado, where there are lots of people working on this issue and not just talking about it and researching it, but really doing it. So I feel very lucky to be in this neurology clinic in behavioral neurology at University of Colorado, where I'm able to treat adults with neurodevelopmental disabilities and treat their neurodevelopmental problems specifically in consultation with their primary care doctor, psychiatrist, and other individuals that are involved in their care. And here in Colorado, there's not just me that has an interest in this adult population of people with disabilities, but there are also doctors in our system that are physiatrists or rehab doctors, do physical medicine and rehabilitation. There's also interest from primary care and internal medicine and pediatrics and family medicine. So I'm also psychiatry with community partners. So I'm very lucky to have these people with whom I can partner to provide care for Coloradans with developmental disabilities as they age into adulthood and as they live as adults. So my practice does not just focus on the transition from pediatric to adult healthcare, but it also focuses on what do adults with developmental disabilities need to thrive and grow and continue living the most fulfilling life as possible as they grow as adults.
In that regard, the idea of collaboration has become very common with the coordinated care concept. And I see you kind of right in the middle of that. You want to talk about how you work with other practices?
This clinic is very new. So the Adult Neurodevelopmental Disability Clinic at University of Colorado in the Behavioral Neurology Clinic is only 1 year old. And so if anything, I've learned that it is very important to collaborate with other physicians and other practitioners, also other community members, to make the health of our patients as healthy as possible, both their brains and bodies and everything in between. So as a doctor for adults with neurodevelopmental disabilities, in terms of coordinated care, I see myself as the consultative doctor that can answer questions and make other doctors feel comfortable regarding a patient with a neurodevelopmental disability. We know, based on a lot of literature and research about the difficulties that adults with developmental disabilities have with finding care, that often other doctors or practices feel uncomfortable specifically about the developmental disability. So they may not be uncomfortable with their issue with their lungs or their heart or their pancreas, but the developmental disability is something with which other practices have reported that they don't feel like they are capable of managing or understanding or directing care for. And so with that coordinated care model, I see myself in the University of Colorado system as a resource to other doctors to help make them feel more comfortable taking on other patients with developmental disabilities and caring for their other needs, knowing that I'll be there as a resource for the developmental disability. So, for example, there are patients with Down syndrome that experience different medical complications. And lots of people wonder, is it the Down syndrome or is it this other medical complication? And so they know that they can send their adult patients to me as someone who knows thousands of people with Down syndrome to be able to parse out the issues that are specific to Down syndrome or are common and ways that those issues can be solved that have to do with Down syndrome, while relying on other doctors to really investigate, work up, and treat the underlying medical issues, knowing they have a partner that understands the developmental disability. I think also I'm really lucky in this practice to have a genetic counselor. And so that is another wonderful addition that provides really extraordinary coordinated care, because not only can I recommend genetic testing or workup for other things going on, but I have someone there whose whole specialty and job is to explain the genetic testing and to explain the results and how that impacts other medical problems and issues going down the road, from brothers and sisters and parents, family planning, to prognosis, to medications that would work better or worse, and everything in between. So the team we have is really fabulous in this first year of this clinic's existence.
Now, I know there's some real special challenges going through the pandemic, and that can negatively impact an awful lot of people struggling with this issue. You are involved with a national study on the impact of that. You want to share that with us?
Yes. So I am involved with the American Academy of Neurology, the section of the AAN called the Section on Adults with Intellectual and Developmental Disabilities. And I'm also involved with the AADMD, American Academy of Developmental Medicine and Dentistry. And with these groups, we get together about monthly to talk over cases and things that we all deal with as practitioners and neurologists who work with and care for adults with developmental disabilities. And one thing we were all noticing as the pandemic was going on was that our patients were really struggling with mental health. And we thought it was really important to document this point in time and demonstrate what changes in people's lives were most associated with the worst mental health people experienced. And so we found we had over 400 people take this survey, really close to 500 people take this survey. A large proportion was from Colorado, which thank you all for anyone who participated here. And we really wanted to hear people's voices in terms of what have been the struggles and what have been the changes in their lives. And then with our statistician who we worked closely with, we were able to correlate these changes in people's lives with their worsening mental health. And so we saw that when people lost access to their job or job supports, when people lost access to their day programs, and most strikingly, when people lost access to their recreational opportunities and exercise, like Special Olympics, that they rated their mental health worse compared to people who didn't lose those activities as drastically. And so this just really demonstrated the importance of community services in mental health. And there's been a lot of news and reports lately about the mental health crisis in our country and how we need more psychiatrists and more therapists. And I could not agree with that more. But what our study adds to the equation is the importance of community supports. And those community supports are out there, but we need to help people connect with them and access them. So I think that is the missing piece that our study helps bring to light, is the help that people need with connecting to services that already exist that can then better their mental health and even physical health now during a pandemic and in the future.
All right, Dr. Sanders, do you have any final thoughts for us today?
My final thoughts is just stressing and emphasizing the importance of inclusion in our community, and that including people with developmental disabilities as a really important pillar of diversity, equity, and inclusion that's being talked about in lots of community organizations and institutions and businesses and schools. And that I think we are all made so much stronger by having connections and meaningful interactions with people who are different than us. And I have benefited so much in my life from growing up around and having friends with developmental disabilities and learning from their perspective how they see the world differently. And I really encourage everyone to seek out these relationships and opportunities for including people who are different in your everyday and even not everyday and special community, school, business, other opportunities, because we are really made stronger by having different points of view available. And the more we get to know people with developmental disabilities, the more we know what they need for support, and the more we can, as a society, raise everyone up and support everyone to live their life to the fullest.
Okay, that's wonderful information. And you've agreed to sit down for another interview to talk about the children with developmental disabilities and how you work through those issues. So we look forward to that. Dr. Sanders, thanks so much for taking the time to share this information with us today.
Thank you so much for having me. Really an honor to talk with you.